we are at a momentous crossroads. Presidents, going back to Harry Truman and Jimmy Carter and President Bill Clinton, have been trying to reform health care. I was here in '93 and '94. We tried and we did not succeed, and it's gotten much worse since then. It's gotten to the point now where we have this opportunity which we must seize. We've seen skyrocketing health care costs affecting everyone, affecting families, affecting hospitals, affecting the way we practice medicine, affecting budgets at state, federal, and local levels. And we're not getting the quality that other countries are. We're very low in quality, 37th in terms of the industrialized world, despite the fact we spend much more than most of these other countries. And so we understand we have to deal with this issue and do it decisively and do it comprehensively. It's a moral imperative, it's an economic imperative, it's a way in which we can, I think, move forward as a nation to provide more opportunity for all of our citizens. Now, we have got to be aggressive, and we've started the process. The Health Committee is already in the midst of marking up the legislation, which means we're actually drafting the language. We've been debating now for, it seems forever, but it's only been about 2 weeks, late into the evening, starting early in the morning. We have moved through prevention issues. We've moved through issues of workforce development, because you can't have a comprehensive expansion of the healthcare system without a comprehensive expansion of the doctors, nurses, anesthesiologists, all of the different health professionals. You can't do that. So we're moving forward. And our goal is to have a system first. If you like the insurance that you have, you can choose to keep it. But if you don't have insurance, or you're dissatisfied with insurance, you'll have options, including a public option, which we're trying to construct. All of these plans will be available in the states on an exchange. Basically, you can go to the website, you can look at the different plans, you can look at the cost and the services they provide, and you can decide. And I think this kind of competition, particularly if there's a public plan in place, will keep pressures down in terms of pricing, because there really will be a market. The other thing we've done is we've eliminated a lot of the ways in which the current insurance market really sort of rigs the rules against people. We're eliminating exclusions by pre-existing condition, so that the insurance company has to take anyone who will pay. So that insurance reform is absolutely critical. We're eliminating the lifetime sort of payment, where some companies have caps. So if you have someone in the family who's gravely ill and they get up to a certain point, they say, well, we don't have to forgive you anything anymore, because you've exhausted your lifetime payments. That's out. So we're going to try to create an even playing field and do it in a way so that coverage will be provided for all of our citizens. And we're also going to ensure that everybody has to participate. One of the problems here is that, there are a lot of people who choose not to have insurance, but then they get into an accident and we all end up paying for it in the emergency room. We've got to have shared responsibility, both on the employee side and the employer side. And so there will be ways to encourage employees to still provide employer coverage, which is very, very important. It's a significant part of our insurance market. And there will also be ways in which we can ensure that we have all of our people participating in the system. We also understand that we have to help moderate and low-income Americans buy insurance, so there'll be subsidies built in, so that it gives you the choice and the ability to make that decision, because you'll have subsidies to make that choice. So we think it's a plan that has not only merit, but is going to have great effect and a positive effect. Now I'm being joined by my colleague, Senator Whitehouse, who is, he deserves a round of applause too. Sheldon and I both I serve on the Help Committee, so we're both engaged in this debate side by side, and he is providing tremendous leadership on a number of issues, and our collaboration is one that I hope is going to benefit not just Rhode Island, but the whole nation. So we're here at this critical moment, and I want to thank you for being here. This is really the face of America. You know, you are the men and women that we have to do our job for, not the lobbyists, not the technical experts, etc., who can come down here, but the men and women of Rhode Island who are the providers, who are the patients, the children. This is where our goal is, that within a very short time, we hope this year, you can at least take one burden off your back. You'd say, I can get affordable health care that will work for my family. And that's the President's goal, and that's our goal. So, okay. Now, there's one question, and then I think Jody will recognize the Senator Whitehouse.
Senator Reid, I really don't know how you do it. You're up there you must be under tremendous pressure from the lobbyists and from the insurance companies. And they clearly had a lot of pressure 16 years ago. So I wonder, what is your technique for fending them off when you know what's the right thing to do?
I'm often mistaken for a staff member. And no, see, Sheldon's this tall. He looks like a senator. No, I'm just joking. They're all over him. But yeah, you know, we've been through this. We have, first of all, on a serious note, I've got an excellent staff that is able to analyze the different proposals. So I go into these meetings, as Sheldon does, well armed with facts and with analysis, so we can just don't sit there and sort of, okay, you must be right because you're saying it. And I think also too is that we're ultimately committed to fixing this system, and that requires change. And we know people don't like change, but we're going to have to make changes. Frankly, you know, change is going to come across a whole spectrum, and so it won't be just insurance companies. It'll be a lot of folks that'll say, "Boy, this is different." Well, it's got to be different. So we're prepared. I think that, and I'll say, I think we have recognized, and part of this is the President's leadership, that this is not only a critical moment, but if we miss it, we might miss the one real opportunity we have to not only provide better health care, but really have a better economy going forward. So we're all energized by our President. So thank you very much. And I know Senator Whitehouse is going to say a few words. Thank you.
I am, yeah.